The treatment really has changed quite a bit, particularly, I would say, definitely in my practice, where I often, if a patient is not on a clinical trial, I now am often using Brentuximab in the second line setting. And initially, we had looked at Brentuximab as part of a clinical trial, using it as a single agent in the second line setting, as a PET adapted approach, where patients got single agent Brentuximab, and then if they were PET negative, they went right to transplant. If they remained PET positive, they got additional chemotherapy with ICE chemotherapy, followed by consideration for transplant. And in that study, actually, 83% of the patients became PET negative, but the majority of those patients did get chemotherapy, did get the combination chemotherapy with ICE, because only about a third of the patients became PET negative with Brentuximab alone. So that is an approach that we had been using when we shortly after we finished that clinical trial. But now more groups have been looking at Brentuximab in combination with other drugs, which had been associated with a much higher complete response rate than what we saw with single-agent Brentuximab. And examples include Brentuximab plus bendamustine, for which there's quite durable, pretty long-term data now with that combination. And Brentuximab has now been combined with all these combination chemotherapy regimens such as ICE and DHAP and ESHAP. It's been looked at in combination with gemcitabine, and most recently it's been looked at in combination with nivolumab, so one of the PD-1 blockade agents. And it's actually in combination with nivolumab is one of the regimens, that combination, that dual combination is what tends to be right now my treatment of choice for a patient who's not otherwise going on a clinical trial. And that's because it's a fairly short regimen. It's only 4 doses of treatment. The complete response rate was fairly favorable, with 61% of the patients having a complete response with that regimen. And the patients so it pretty effectively bridges quite a number of patients to transplant, and there's it's still fairly early, but there's some durability that has been reported with that regimen. So, and it tends to be fairly well tolerated. So I do tend to like that regimen.